Forced COVID vaccinations. That's the topic of today's Bold and Blunt. And I'm your host, Cheryl Chumley, giving you a Christian conservative look at today's news, politics, culture, and events. And today, on the heels of the FDA's approval of COVID-19 vaccines coming to a community near you, are company-sponsored mandates for employees to take the vaccines, as a condition of continuing employment. Mark those words. And you know what? You don't even have to mark my words. We can hear it from the very mouths of the experts, the so-called policy experts like Dr. Anthony Fauci, who made no short time of running the media gamut to tell us all in America that yes, indeed, forced vaccinations are coming. And that's something that he thinks we should all meet with rounds of cheery applause. I say, what about my body, my right? What about my body, my choice? What about the notion of individual rights and the individual's right to determine his or her own medical treatment? Now we're going to have the free market weaponized against the Constitution and civil liberties, and chaos is going to result. The court system, wait for it, is going to be overrun with lawsuits. Hopefully, the courts will do the right thing, but in this current political climate where it seems the far left agenda is running roughshod over individual God-given rights, I'm not too optimistic. And my guest today is none other than Senator Ron Johnson, who penned an extraordinary letter to the bureaucratic chiefs of the federal health agencies, warning against this quick and speedy approval process for the COVID vaccines, because as he wrote, and as he will tell us in just a few minutes, the numbers of fatalities of those who took the COVID vaccines over the last year that it's been around far surpass the number of fatalities of those who have taken all vaccines in the last 31 years. That's according to reportings to the federal database that tracks such vaccine-tied outcomes. So he's going to come on and he's going to explain the numbers and issue some much-needed cooler head data-driven opinion here on whether or not these vaccines that the FDA is claiming are oh so safe are indeed as oh so safe as the FDA is claiming. But first, I want to give a quick heads up to Edify. Edify, E-D-I-F-I. Edify is a platform that is now carrying my Bold and Blunt podcast, and it is a remarkable platform because it's specifically for Christian type viewpoints. It's where Christians go to get their inspiration. It's where Christians go to get their motivation. It's where Christians go, and those of faith in general go to get their daily dose of news from a, guess what, Christian perspective. And Bold and Blunt ties into that because, of course, Bold and Blunt, Christian conservative and unapologetic about it. So make sure you go to Edify and check out my Bold and Blunt that's there, and check out the other products that are on Edify as well. They're online, but of course you can download Edify to your app and get all the podcasts that they have to offer right on your phone as you're going about your daily business. And also a quick heads up, of course, to the Washington Times, who is offering right now, as we speak, as I speak, a great offer for listeners of the Bold and Blunt podcast, and that is a special discount rate for a full year's access to all the Washington Times has to offer on its digital platform. It's a 50% off discount. Go to washingtontimes.com/Cheryl, type in your info, can't take more than a few seconds, and boom, right away you will have access to the digital edition of the Washington Times. So you will get the Washington Times news, the Washington Times commentaries, and the Washington Times podcast, all the podcasts, not just Bold and Blunt. And more than that, you're going to support the hard work of the Washington Times staff right? Because we all know that the mainstream media is out there busily trying to tear down America from the inside by bringing forth all the deceptive news that they can muster that stands in defense of the far left socialist slash communist agenda. So where do you go to get the truth? Well, the Washington Times. So when you buy into a digital subscription of the Washington Times, discounted as it is, you are supporting the work of the Washington Times, and you are in essence helping fight these far left nutcases that have taken over the Democrat Party and are masquerading as pro-American types. So make sure you go there and sign up. It would be my great honor to have you as a regular reader of the Washington Times and as a regular listener to the Bold and Blunt podcast. And one more quick shout out. If you like Bold and Blunt and you like reading my commentaries at the Washington Times, please go to washingtontimes.com, find my hyperlinked name, scroll down to the bottom of any one of my pieces, and you will have quick and easy directions on how to subscribe to my 3 times a week newsletter, Monday, Wednesday, Friday, before lunchtime, right in your email box. You will get a newsletter that contains all my commentaries for the week, as well as my twice weekly podcasts that come out on Tuesday and Thursday. Why search when you can get it delivered right to your email door? So, vaccine mandates. Let's take a listen to Dr. Anthony Fauci talking about the latest in the FDA approvals and giving a heads up of what's to come.
You've expressed some confidence, Dr. Fauci, that this full approval is going to move the needle in terms of vaccinations. Is that because you think that previously skeptical folks are going to suddenly rush out and get the shot? Or is that because more private companies will be able to mandate that they get the shot?
It's going to be both. There's a survey that shows that about 30% of the people who have not gotten vaccinated and have been reluctant to get vaccinated have said that once they get what they consider the stamp of approval, the final imprimatur from the FDA, that they would very seriously consider getting vaccinated. So that's one element. The second element is what you just said on the piece, is that there will now be much more enthusiasm in mandating vaccines, be they in corporations, places of employment, universities, colleges, the military. All of that, I believe, will contribute greatly to the number of people vaccinated. And the third thing is that the company, in this case Pfizer, can now advertise. So there'll be a lot more advertisement out there, which you were not allowed to do unless you did get full approval.
So we're about to be inundated on our TV screens with advertising about the need to go out and get the vaccine. And mark these words, they're going to make it a patriotic duty. They, in fact, already have. Over the last few months, you've seen the Democrat Party, you've seen the far left, you've seen the bureaucrats that have taken over the federal health agencies at the federal level. You've seen them all sort of scorn those Americans who resist taking the vaccine for whatever personal reasons they have to do that. You've seen the scorn and derision come from these far leftists who say that those who don't take the vaccine are unpatriotic. They are not doing their good American patriotic duty. And in fact, you've seen them labeled as dangers to society. You've heard the likes of Geraldo Rivera go out there on national media and call for, nay, demand that those who don't take the vaccine be forced quarantine into their homes to stay off the streets, stay out of restaurants, that they don't deserve to have freedom any longer because they won't take the vaccine. Well, look, there are serious reasons here to question the safety of the COVID-19 vaccines. This is why individual choice reigns and should reign in America. Because in this particular case, the vaccines have been issued under, up until just recently, emergency use authorization. That means that the bureaucrats in the political world have declared that the coronavirus has been enough of a health emergency to American citizens that they have given the rubber stamp, the thumbs up, for Big Pharma to develop and sell vaccines that supposedly counter the effects of COVID-19. But the thing is, it's been under emergency use authorization. So that means that it's been sped up slightly. Usually in America, according to norms, it can take years to fully develop a vaccine and get it to the stage where it can be marketed for sale, where it can be actually given in your doctor's office at will, at request. But under this COVID chaos that's come over the last year and a half, the vaccine has been allowed to be administered under emergency use authorization. So the thing is, the feds put out that even though it's emergency use authorization, they insist that it's still safe. It's safe, completely safe. The safest thing you could ever do in your entire life is to get this shot. That's how safe it is. That it's both safe and effective. But common sense will tell you that it could be safe and effective in the short term, right? Their studies, their reports, their research, the data could show that indeed, in the short term, it is both safe and effective, though effective is such a undefined word because to the common American citizen, effective means you take the shot, you're not going to get COVID. But we're finding out more and more that those have been fully vaccinated are still testing positive for COVID. So the word effective, I guess, is in the eye of the beholder, sort of like beauty. Effective with this shot is in the eye of the beholder. But that to the side, if you deem for yourself that this shot is indeed safe enough and effective enough that you want to take it, okay, the feds can make the case using their own data that for the short term, meaning less than a year or so, it is safe and effective. But for the long term, who knows? How does anybody in the world know what this shot will do 5 years down the line? You take the shot today, 5 years down the line, your body starts reacting to it in ways that could not have been predicted, or perhaps were predicted, but were pushed to the side because it wasn't politically expedient. It wasn't something that the feds wanted to put out in 2021. But who's to say 5 years down the line what this shot will do to your body? Who's to say 7 years down the line? 10 years down the line? Who's to say that what it would do to a woman who then goes on to have children? Who's to say how that particular chemical in her body will impact her child that is born? We don't know. We don't know. And no matter how hard the feds try to spin it and sell it, that adverse impacts won't come no matter what down the line. The fact is, that's a deception. They cannot guarantee that. They cannot guarantee that that won't happen. As a matter of fact, as my guest, Senator Ron Johnson, is going to show in our discussion, they can't even guarantee in the short term that it's safe and effective. Because if safe and effective dismisses the fact of thousands and thousands and thousands of reports of fatalities that have come either shortly or within 2 days after taking the COVID vaccine, then you know what? I don't want safe and effective. And you shouldn't want safe and effective either. These are serious questions that the federal government does not want to answer. For whatever reason, the federal government is unwilling, reluctant to answer these questions. And more than that, you can understand a government, right, that doesn't want to answer questions because, to be truthful, that's very often how governments run. They just turn blind eyes to problems. They just refuse to answer the public's concern. But on this particular COVID vaccine, what you can't understand, what I can't understand anyhow, is why those who ask questions, those who dare to use critical thinking here, those who dare to independently research the data and to take their independent research and to challenge what the government is putting forward about safe and effective with these vaccines, that those people, the independent thinkers out there, the critical thinkers, are deemed dangerous and booted off of social media, booted from the public platform. That in itself is a red flag. Common sense will tell you, if you're branded a danger to society for the simple act of asking a question, then something's wrong. Something's wrong there. And suddenly, free society is under attack. Okay, let's go back to Anthony Fauci real quick. Another quote. This, by the way, was from the Today Show. It was from the Today Show on Tuesday. And let's listen in again.
Well, let's talk about this group that's still not eligible. And as a parent of two small children under the age of 12, what's the likelihood that that group is going to be able to get the shot before the Christmas holidays?
I think there's a reasonable chance that that'll be the case. What's going on right now is that the companies, both Pfizer and Moderna, at least two of them, as well as working with the NIH Clinical Trials Group in my own institute, are working very hard to get data on both the safety, the correct dose, as well as the immunogenicity, namely the predictability that these vaccines will be effective.
It's coming to your kids. If you've been reluctant to take the shot as a parent or as an adult, and now you're feeling the pressure because the mandates are coming, here comes the next step. Here comes the next step in the government's forced vaccination program. It's coming to the kids. So if you've been worried about what's going to happen in the long term for adults, for yourself, here's the next worry. What's going to happen in the long term for your kids? Are your kids going to be shut out of school? Are your kids going to be shut out of travel? Are your kids going to be shut out of going to the store, associating with their friends? Are your kids going to be, in essence, placed in solitary confinement if, as a parent, you decide that you don't want your child to take the shot? It's getting ridiculous out there. The idea of individual rights has crumbled more in this last year of coronavirus clampdowns from the government, from the leftists, from the Democrat Party, from the bureaucrats, than I ever envisioned in such a short time. Something like this should take 50 years, but one coronavirus, see you later, civil liberties. My guest today, Senator Ron Johnson, as I said, he has penned this great letter to the health bureaucrat chiefs filled with data that you need to be aware of before you line up to take the vaccine. Senator Ron Johnson, thank you so much for being on Bold and Blunt. I appreciate your time.
Appreciate the opportunity, Cheryl.
You sent a letter to the heads of NIH, CDC, FDA, expressing concern about what you say was the little bit short-circuited approval process for COVID-19 vaccines. And I wanted to start by asking you, what is the significance of the FDA not holding that final formal advisory committee?
Well, they don't have independent review of the safety and efficacy data. And there's nothing made public about it as well. There's so much we don't know about COVID. I mean, nobody knows it. A lot we need to learn, but there should be a lot of things we do know now. There should be data that we've been gathering. And, certainly countries like the UK, Israel, they're gathering data in terms of new cases, adverse effects, deaths between vaccinated individuals and unvaccinated individuals. We're kind of watching with, I think, some real concern about what's happening, particularly in Israel. But we don't have that data here in the U.S. And instead, we just go ahead and approve the Pfizer vaccine. And I would say the phase 2 and phase 3 portion of the approval process was definitely rushed. I mean, that is the observational part of FDA approval. It takes time to observe whether there's going to be some long-term impacts of this. I mean, how can you judge long-term impacts if you don't wait for the long term? And I think the point I argued, and there was a group of doctors that petitioned the FDA saying there was no reason to approve these drugs right now. You have an emergency use authorization. Anybody 16, actually 12 years and older that wanted the drug, that wanted the vaccine, could get the vaccine. So why rush the approval when there's so many unknowns? So that was my point of sending the letter. Now, what prompted it was their announcement they weren't going to hold this vaccine and related biological products advisory committee meeting. But also, we heard that they were going to approve this thing yesterday, and of course, they did approve this. We think they approved it. That's the other thing that's bizarre about the two letters. There's a letter that extends the emergency use authorization, and then they're apparently approving the European version of this, the vaccine that's being produced by BioNTech, which is Pfizer's partner in Europe, and under that label. So this is very confusing. We're trying to sort it out right now. So it's just bizarre what the FDA has done at this point in time, particularly in light of what you see in their own safety warning system, the VAERS system, which they are almost in a complete state of denial on. They keep saying, well, there's no evidence of harm. Well, there's no evidence if you don't look for evidence, if you completely ignore what your early warning system is telling you. But if I could just lay out some figures for people.
Yes, I do want to get into these figures. Go ahead. If you have them at your hand, go ahead and tell people what you're talking about.
So the most recent number, and over the weekend as I was assembling this letter, the VAERS system wasn't totally up to date, but again, we're updating this on a weekly basis. But so far, there are 13,068 deaths reported worldwide on the vaccine adverse event reporting system. This is the CDC FDA early warning system. So 13,068. Now that compares to, over 8 months, that compares to 8,970 deaths over 31 years for all other vaccines reported through the VAERS system. So 13,000 versus almost 9,000 over 31 years.
And I just want to clarify that when you're talking about deaths, you're talking about deaths that occurred within the same day, first day, or second day of the patient taking the coronavirus shot. Is that true?
No. So that number is 4,698.
Okay.
13,000. 13,000 can go on for actually quite some time, but most of them are reported in 30 to 60 days. Again, because people die, but it's what you report to the VAERS is when people die in somewhat close proximity to the vaccine. Again, it doesn't prove causation, but when you have 36% of those 13,000 deaths, 4,698 that are occurring on the day of vaccination or day 1 and 2, it certainly raises questions.
Yes.
And I first raised this with Director Collins, I think, back in April in a meeting with some other Republican senators. He pretty well just blew me off. So, Senator, people die. He said, we've identified 6 deaths. These were with the young women that were of childbearing age that died of blood clots. Those are the only deaths that the CDC, the FDA have associated with the vaccine, even though their VAERS system have reports of over 13,000. And by the way, because I am sort of the tip of the spear here, because I've been advocating for early treatment and I've been vocal about the VAERS system, I am just getting inundated now with letters and emails and other forms of communication of healthcare workers, nurses, doctors who are seeing adverse events. They're being discouraged, if not prevented, from reporting them. They're telling me very few doctors and nurses even know about the VAERS system. So, one of the criticisms of the VAERS, in addition to the fact that it doesn't prove cause, and that's true, but another criticism is it grossly understates the number of adverse events. There's a Harvard study that said it probably only captures about 1%. Now, I think with COVID, personally, it probably captures a higher percentage, but we're just scratching the surface here as I'm talking to doctors and nurses of how many adverse events there truly are. Neurological problems, clotting, strokes. It's a cornucopia of problems that people certainly believe are associated with the vaccine because they were pretty healthy. They get the vaccine within a few days, a couple of weeks. All of a sudden, they're dealing with these serious health issues.
Well, I think the big takeaway here is no matter how many are being reported or underreported, the fact is if you compare 13,000 in a matter of 8 months versus 8,900 and some change in the matter of 31 years, that's huge. And I can't believe our federal bureaucrats in the health system are ignoring this and dismissing you.
Well, they're doing far more than dismissing me. They're attacking me. I mean, the day that they responded to, that they approved this and responded to my letter, I did get a response. It's pretty much bureaucrat mumbo jumbo. They also issued an advisory against animal ivermectin for human use. Well, of course. But I think they do that because I've been an advocate for early treatment. I'm very agnostic. I don't care what drug will work. Try a bunch of them, particularly the ones that are safe. Uh, you know, by the way, ivermectin, I think, over 31 years, I think it has less than 100 deaths reported. Ivermectin has. I think hydroxychloroquine has a couple hundred deaths.
Wow.
So, I mean, these are the drugs that now the CDC is warning the public, and they know the public's going to conflate these. I mean, you've already got TV personalities, you already have the Milwaukee Journal Sentinel say that Johnson's been pushing these animal drugs. Nothing could be further from the truth. But the CDC issues this warning because they know exactly how the press is going to cover this. But you know, why not allow doctors to use their off-label prescription rights and experiment with different things that just might help? And of course, there's growing evidence that ivermectin can be effective, not universally. Hydroxychloroquine in combination with zinc and vitamin C and vitamin D. I mean, these multi-drug protocols, there are a lot of doctors that swear by them and believe they're effective. I'm not a doctor. I'm not a medical researcher. But I'm just somebody with an open mind and asking questions, which apparently you can't ask these questions anymore. The COVID gods have made their pronouncements, and you follow them or else.
You get booted.
My final point, the NIH's guideline to this day is, in terms of treatment of COVID, do nothing. Don't do anything. Go home, be afraid, isolate yourself, and if you get sick enough, if your oxygen levels drop low enough, then check yourself in the hospital and cross your fingers. Hopefully, we can successfully treat you once you're way too sick, which flies in the face of everything I've ever heard about medicine. Early detection leads to early treatment, produces better outcomes. Why have we abandoned that at the federal level and our media and social media with COVID? It is crazy. It's insane. If that's the position we're taking right now, and anybody like myself that's encouraging early treatment gets vilified. I was called by the New York Times the snake oil salesman of the Senate because I held a hearing on early treatment.
You know, anybody who asks questions about just the common sense idea of these vaccines being deemed completely safe by the federal government when they don't know any long-term effects from them, that gets you labeled a danger to society. And I wonder if you've seen the latest. Alex Berenson has done an excellent job of reporting on the facts behind the stated facts of the COVID-19 crisis and vaccines. He just put out a Twitter feed that talked about a report out of Japan that actually is finding that these COVID vaccines may be making the problem worse when it comes to the Delta variant. Have you seen that report?
Haven't seen that specific one, but I've heard about antibody-dependent enhancement. This actually happened with the disease in chickens, where the vaccines or the antibiotics given to animals actually enhance the disease. And again, diseases mutate, whether it's bacteria, whether it's viruses, they mutate. They figure out a way around things like vaccine. And in some cases, they may get more powerful. Generally, they get less powerful. But no, listen, because I've been connected to a global network of top-notch medical doctors and researchers, I've heard all kinds of scary theories. There's no doubt about it. And that's all I'm asking is the FDA ought to be opening up their mind to some of these concerns. I mean, big concerns with the lipid nanoparticles in the Pfizer acknowledgement to the Japanese authorities are accumulating in the ovaries and the testes. What impact could that have? And particularly if they're carrying messenger RNA that will produce spike proteins delivered to those organs. Again, pregnant women won't even drink a half a glass of wine, concerned they may affect their little baby, but yet we're saying, yeah, go ahead, let's give them this experimental vaccine, which now apparently is approved, I think.
We think.
The European one. Again, it just doesn't make sense. There's so much about COVID that doesn't make sense, but you're not allowed to ask questions.
So let me wrap up because I know your time is tight and I'm appreciative of the time you've given me. Let me wrap up by asking, people listening to you right now are trusting what you're saying because Americans aren't stupid. But what they want to know is how are they going to fight these vaccine mandates that are coming from their very own employers? What can they do?
Well, first of all, I was on a call with doctors all over the country. and they all are given about 60 to a minute or two to just describe what's happening on the ground. And listen, there's a variety. Some hospitals are getting slammed, but most hospitals, the biggest problem they have is they can't staff them. They're shutting down wings because they simply don't have the nursing staff or the healthcare staff. So these mandates, again, I'm listening to the nurses who are seeing the vaccine injuries. They're not going to get vaccinated. So you're just going to exacerbate the healthcare worker shortage. This makes no sense. I mean, my guess is you are going to see walk-offs. People that have witnessed vaccine injuries, these neurological injuries, the paralysis, the strokes, the clotting. I mean, they're witnessing. They're trying to treat them. They're not going to get the vaccine. So, my guess is you will see more and more people just walk off the job, and not only in healthcare, but there's not a business in Wisconsin that can hire enough people. So I think these mandates are going to backfire. But again, there should not be mandates. People should not be pressured, coerced, or fear reprisal for not taking a medical treatment, including the COVID vaccine, particularly when we know now that if you get vaccinated, that doesn't prevent you from getting the disease. The viral loads are sky high with people that are formally vaccinated. They may be walking around asymptomatic with a high viral load, spreading it more than an unvaccinated person. I mean, again, we don't know. We're not being told these things. We're having to rely on Alex Berenson in a tweet highlighting the study because our CDC, our FDA, they're not holding public hearings to actually have people with opposing points of view. Sure, as long as I've been alive, when it comes to a medical condition, I've always been told you really ought to get a second, maybe even a third opinion.
Exactly.
We're not allowed. There is no such thing as a second opinion with COVID. There's only the pronouncements from the COVID gods, from the CDC, the NIH, and the FDA, and do not question them. Or you will be attacked, you will be vilified. If you're a political figure like myself, you will be destroyed.
Let me ask.
What's happening in this country today?
Let me ask this final question. Do you personally think these vaccines are safe enough that you would want your own kids to take them?
Well, I'll tell you, my family, some of my family members have gotten the vaccine, some haven't. I'm letting them make that choice. I don't encourage, I don't discourage. I just give people the facts. It is true that hundreds of millions of doses have been administered in the U.S., and the vast majority of those have been without any adverse effects. But there are been some very adverse effects, including death, and all I'm saying is it can't be ignored. So I think my role is to encourage or force the government to be transparent, be honest. I mean, I think the fact that the public perceives, and I think correctly, that the healthcare agencies have not been honest, they have not been transparent, that they seem to be hiding something, I think that's exacerbating the problem. I've also pushed back on this term vaccine hesitancy. I've gotten every vaccine since the swine flu. I didn't get this one because I was previously infected. The fact that the FDA and the CDC have completely ignored the benefit of natural immunity, which is probably, I think it's proving out, far more effective than vaccine immunity because the vaccine is only focusing on the spike protein where natural immunity recognizes the entire vaccine.
Yep.
Okay? So again, I think the healthcare agencies are losing integrity because they're not being transparent, they're not being honest. And so, from my standpoint, I think people just need to get informed. Listen, if you have a comorbidity, if you're old, if you're obese, you ought to really be considering taking the vaccine. But I think you need to do it with your eyes wide open and pay attention to what your body's telling you.
Yep.
So again, I'm not a doctor. I'm not a medical researcher. I'm just a citizen legislator that is trying to make sure that these healthcare agencies are transparent, so the American public has the information they need and that they deserve, so they can make their own informed choice.
Absolutely. Because right now it's kind of like, what are they afraid to let the American people know? So truth-telling could go far here. And Senator Ron Johnson, all eyes on you because you're one of the few voices on Capitol Hill that are actually taking this fight for the American citizen. And we appreciate it. Thank you very much.
Appreciate your interest. Stay healthy.
You too. Bold and blunt listeners, I encourage you to go to Senator Johnson's website and read the full text of the letter yourself and check out his data. Look, the way truthfulness and transparency work is that those who are giving you truthful, transparent info, they want you to fact check them. Unlike the federal government that doesn't even want to answer simple questions from the American citizens about, oh, I don't know, is this shot safe 5 years down the line? And, oh, what about that whole notion of natural immunity? Or how about this, as raised by the senator in this discussion? Has the FDA even fully approved the vaccines? It's very strange. It's very strange these very simple questions go unanswered from the very federal authorities who are supposed to protect us. So it's up to you, the American citizen, to do your own data research, starting with, like I said, reading this letter. Thanks for listening. Tune in next time. And don't forget, for more great podcasts to build your faith, to inspire you, head on over to edify.app and search for the Edify app on Apple and Google Play stores. Stay blunt, stay bold.